Hello, I'm Vanessa and I'll be talking about TeleNursing today. According to our health informatics book by Hebda and Czar, TeleNursing is a voice and video interactive teleconference system that nurses use to communicate with clients. An example of the advantages of using telenursing would include a home health nurse who sees more patients via telenursing rather than on-site visits. I believe this would be due to the driving distances that a home health nurse has to do. So there's that. Telenursing addresses patients who live in rural areas or who lack access to healthcare services. It also addresses patients who live in a state where there is a nursing shortage. I believe North Carolina is one of those states, but don't quote me on that. Some issues in regards to telenursing include reimbursement, licensure, liability, privacy, confidentiality, quality of care, education, and training of telehealth apps. An example of a reimbursement issue would be how would hospitals pay nurses for their telenursing services? Would this be per hour or per consulting session? And I believe that would be up to the healthcare facility in which the nurse would work in. A confidentiality issue would be what if the patient only has access to a computer at a public library? How would the nurse be able to communicate with the patient without breaking confidentiality? How would she be able to talk about the patient's diagnosis or the patient's health information? So that's an issue. And an example of a quality of care issue, yes, you may be able to perform a visual assessment on the patient, or yes, you may be able to observe the patient. You may even be able to instruct the patient to take his or her own pulse, but you won't be able to auscultate heart, lung, and bowel sounds. You will not be able to palpate the patient, have that touch. You won't be able to touch the patient, and you will not be able to obtain a complete assessment on the patient. Another example of an issue would be an example of an educational issue. Yes, the majority of patients are audio and visual learners, but what about kinesthetic learners? The nurse may try to teach the patient something, but the patient needs that hands-on experience in order to learn. So there's that. Then we have an example of a training issue. Hospitals may be able to include telenursing training in their orientation modules for employees, but what about the patients? Would the patients then be required to complete a course on telehealth, or how would that work? So that's another issue that we have there. In 1999, the American Nurses Association published national guidelines in telehealth in order to protect patient privacy and improve the delivery of telehealth services. Today, many believe that telenursing should be a specialty in nursing and that it should no longer be incorporated in standard nursing school curriculum, and instead that it should be included in a graduate program that has a business model and the infrastructure necessary to support telehealth practice. So that's something to think about. That's all I have for now. Thank you.